Good evening, everybody. My name is Linda Feld, and I'm a board member of the Periodic Paralysis International, who is bringing this webinar to you tonight. And as you can see, there are some other people on our screen at this point that will be here for a little while, and then they're going to disappear as each one of us speaks. Cheryl, who is also one of our board members at the Periodic Paralysis International. We have Janine Kent, who is another board member and will be speaking shortly. And we have Dr. Santiago, who will be taking part in part 2 of our webinar tonight. So we welcome all of you, and we're going to move on to part 2 of our webinar tonight. And Dr. Santiago is already on the screen. She's a good friend of mine because she has done so much for me to make me feel better with my periodic paralysis. And I am genetically diagnosed, but I have lymphedema with my periodic paralysis. And she has just been a godsend to me in helping me in a way that when we started, we didn't even know if it would work or not. We tried an experiment. So I'm going to let her tell you a little bit about herself, and I want to give her max time to talk about this because I think she's just amazing. So I'm going to turn it over to her and keep asking questions. We'll get them all answered. Dr. Santiago, it's all yours.
Thank you, Linda. Before I start my presentation, I like to first talk a little bit about my background and how I help Linda. And just like any other, you guys were talking about healthcare professionals that are completely unfamiliar with this condition. I was one of them, but I like to help people. That's my passion. And if I don't know something, I look it up. And Linda and I, we became a team. And as I told her, like I have this program that is very effective in the treatment and management of lymphedema, but because her lymphedema was related to the the periodic paralysis, I was very honest with her and I said, I'm gonna give you everything that I know. I just don't know if it's gonna work for you because obviously you have a condition that is going to limit some of the things that you need to do to manage the lymphedema. But needless to say, it worked and she did absolutely amazing. And I'm very proud of her. And we were able to decongest her. And I'll explain what that means. So that's kind of like in a nutshell, my experience with Linda. So now formally introduce myself. I'm Dr. Nilma Santiago. I am a physical therapist who specializes in lymphedema management. I am also wound care certified and ostomy management specialist. So I have my private practice in Longwood, Florida. It's called Integumentary Physiotherapy Clinic, and I specialize in lymphedema management, where I see patients with primary and secondary lymphedema. And then the treatment that I provide is called complete decongestant therapy. So without further ado, I'm going to share my screen so I can give you the presentation. Oh, there it is. Okay. All right. So let me put this over here so it doesn't. All right. So complete decongestant therapy for lymphedema management. So the objectives that I have for this presentation today, I want to discuss with you guys primary and secondary lymphedema, identify the causes of lymphedema, discuss treatments, for lymphedema, treatment options for lymphedema, what is complete decongestant therapy, which is the program that I provide, and discuss additional treatments that can be done for it. So lymphedema is a condition of the lymphatic system. And the lymphatic system is what we have to manage the excess fluid in the body. Along with the kidneys, it helps manage the excess fluid. It also cleanses our body from toxins, has a huge role with inflammation or helping the body get rid of inflammation because it transports white blood cells, especially that first line of defense. It's called the macrophages, these particular cells that facilitate that first inflammatory process so the body can actually continue to and heal itself. It also transports fats and proteins and nutrients that we need. So what happened with lymphedema per se is that this fluid that is called lymph, it actually escapes to the spaces in between the skin cells. So the way that it works, and I'm going to try to explain it very, very simplistic, very in layman's terms. So when our heart pumps blood, the blood goes through the arteries to the tissues, and the veins are supposed to return the blood, the white blood cells, the red blood cells, the plasma, everything that I told you, fluid and all of this. Under normal circumstances, every single person that doesn't have lymphedema, that happens 80%. So 80% of all of that I told you goes through the veins, but 20% it goes through the lymphatic collectors. And the way that it works is that fluid, plasma, proteins, white blood cells, fats escapes to the spaces in between the capillaries, and the lymphatic collectors grab it and then drain it all the way back to the circulation. So the lymphatic system works as a network of vessels that facilitate cleansing the body from all the toxins, as I mentioned, and helping with that inflammatory response. So if you have a lymphatic dysfunction, either for a secondary to a medical condition, a chronic inflammatory condition, or primarily because it was a congenital problem with your lymphatic system, either less lymphatic nodes, less lymphatic collectors, or you acquire a problem with your lymphatic nodes, then you can develop lymphedema because the lymphatic system is unable to transport that fluid back to the circulation. So in this picture, I have a patient of mine, and as you can see, she has lymphedema on the right lower extremity. And you can see the difference in between the thigh, the knee, and the calf. This particular patient has lymphedema, secondary lymphedema, because she had colon cancer. And during the treatment with the chemotherapy, then the lymph nodes were damaged, and then she developed lymphedema. So, as I mentioned briefly, the causes of lymphedema are various, but the most important thing is to categorize it between primary and secondary. Primary lymphedema, as I mentioned, is congenital, is caused by a problem with the lymphatic vessels, and is also hereditary. So some person, you know, in the family, your father, your mother, your grandmother could have had lymphedema, and then it passed on the genes. But it also can happen, as I mentioned, secondary to another condition that damaged the lymphatic collectors, the lymphatic nodes, or the lymphatic network as a whole. And that occurs when, you know, after cancer, radiation, chemotherapy, infections, surgeries, kidney problems, liver problems, lung problems, cardiac problems. It also can happen due to vascular or circulation problems. In this picture that we see, this is a lady that has secondary lymphedema, and this one is particularly caused by this parasite that is called filariasis. This particular type of secondary lymphedema normally happens in developing countries, and it's due to the literally bite of this mosquito that has this particular bacteria and causes filariasis. And then this particular parasite loves to literally stay within the lymphatic nodes, and then the patient, or in this case, right, the person develops lymphedema. And I want you to look at her hands, and also obviously the left leg. And as you can see, all of that is swollen because after the mosquito bite, the parasite actually infected all those areas, and that's why she developed lymphedema in this particular picture. So there are 4 stages of lymphedema, and this actually has been documented by the International Society of Lymphology. histology. There's stage 0, and that is this latency stage. So this is when the swelling is not very evident, and actually it just shows some what we call lymphatic insufficiency. So when a patient is in latency stage, unfortunately, the physicians are not going to indicate, oh, you have lymphedema. Most of the time it's like, oh, you have some swelling, maybe you put some compression stockings, or, oh, maybe you had an ankle sprain if it was in the leg, oh, your hand, oh, maybe you just ate too much salt. Unfortunately, a lot of times before the patient actually received lymphedema management or lymphedema treatments, they had already been through stage 0 and stage 1. Most of the patients that I see are actually stage 2 patients, which unfortunately, this is when the limb, the area, the extremity doesn't improve with elevation. There's a lot of what we call pitting edema, which is when the skin indents. And there is what we call fibrosis, which is this very hardening skin that can literally become not only like hard as like when you touch it, it's really tight, but it also can develop different skin conditions like what we call lymphatic cysts, where the patient is leaking fluid out of the extremity. And that happens, of those higher stages. Now, I have to say that I'm very grateful that a lot of physicians are referring me patients when they start noticing just a little bit of swelling, or the patient, like you guys were talking about, advocating for themselves, said, I noticed that I have some swelling in my legs, or I have some swelling in my ankle. And then this particular physician said, because they've been working with me for 4 years now, referring patients, they automatically send them to me so I can help with the diagnosis. And I can tell you, we've been able to help people in stage 1, which is that accumulation of fluid actually improves significantly just with some exercises, elevation, and the wearing of compression garments. But let me go back again. And like I said, stage 0 is when the swelling is not very evident, but there's definitely an impairment in that lymphatic drainage. Stage 1, we start having accumulating of fluid. And then the elevating the extremity actually helps decrease the swelling, and the pitting edema may or may not occur, that indentation of the skin. Most patients that are in that stage will notice, just maybe if it's in the arm, they might notice that the wrist band or the watch or some bracelet is a little tight, or maybe the rings. In the case of the legs, they might feel that the shoes are kind of tight, that yesterday they were able to wear them no problem, and today they're kind of a little tight. Stage 2 is when that swelling does not subside with elevation. As I mentioned briefly, like a couple of minutes ago, the skin can get so tight, it could be what we call indurated, which is really hard, and fibrotic. And it's literally this accumulation of protein that over time has created so much inflammation. The skin gets really, really hard and red, and that is very painful. And as I mentioned, most patients that I see are in that stage 2. Then stage 3 is when they're actually a deformity in the in the limb itself. So I'm gonna go back one. So this lady that we see here, she has a stage 3 lymphedema. As you can see, there is some deformity of the foot with all these areas that look like little warts. These are actually called skin hyperplasia with papillomas. And this actually can get better with treatment. It just takes longer, but that is what stage 3 looks like. There is lymphostatic elephantiasis, which is literally that kind of like elephant look-like skin that is like cobblestone, very, very hard. Sometimes when I have patients in stage 3, I can actually feel the skin that literally feels as hard as a door, and I am not exaggerating. Now, when they have this type of stage 3 lymphedema, that pitting edema, that's indentation of the skin, you cannot see because there's so much fibrosis. There's so much literally hard skin that the skin actually doesn't indent. So a lot of times, these patients, they do have swelling fluid, but it's not evident like in stage 2 or even stage 1 with the pitting, with the indentation of the limb or the skin. So here we have the way that it looks, the 4 stages. Stage 1, stage 0, as you can see, this particular patient here, we can see that the left thigh and knee and calf, it's actually bigger than the right, and you can see it on the ankle as well. But for somebody that doesn't know or is not educated in what lymphedema looks like, the patient can come to, can go to their physician and say, hey, I noticed that my left leg is kind of more swollen and I feel discomfort. And they might say, oh, you're just fine. Just put some compression salts. You might have just eating a lot of salt, which is sad because a lot of times, if obviously, like everything, right, prevention is the best medicine. If you know something that's happening in the early stages, the prognosis is always better. But I am, like I said, very grateful to say that even very, very, very significant lymphedemas like stage 3s, I am very grateful that we've been able to help them as well. Okay, stage 1, as you can see, we have a significantly higher limb. The picture actually shows, if you can notice on the left side, that file looks kind of pink. It's because it's really red. Obviously, I have to increase the picture. But the thing is that you see that kind of pinkish, that's actually redness. So it's very inflamed. There's a lot of discomfort, tenderness. The other thing is, again, you can look at the calf. The calf doesn't have like that, like nice demarcation between the actual calf muscle and the ankle. And the other thing that I want you to notice is on the dorsum of her foot, it looks kind of flattened, but in this particular case, it's just because of the picture, because they actually developed what is called a buffalo hump. And I promise you that's the medical term, even though it sounds very funny, but it's true. That's called buffalo hump. And your stage 2, as you can see, we see more of that swelling in the leg, in this case, the left lower leg. The calf is very big. You have that indentation in the ankle. And if you look at the stage 3, it's more evident that buffalo hump, and that's what it's called on the dorsum of the foot. The other thing is, if you notice the toes, and again, this is going to sound kind of funny, but somebody decided that was going to be the medical term, and that wasn't me. It's called sausage toes, and they literally look like little sausages that also can improve with treatment. Now, if we go again and look about at stage 3, you see all the skin folds, this kind of like deformity on the leg itself. If I have this patient in front of me and I can feel the skin, I can tell you that it's very, very tight, very indurated, very hard, and very painful. Now, when I actually, and I apologize, I should have told you, I've been practicing lymphedema management since 2010. I've been a physical therapist for almost 20 years. So what I was going to tell you is, when I actually started doing lymphedema management, one of the things that I learned was that lymphedema doesn't hurt. Obviously, now that was in 2010, and now we're in 2024. There's more science, more education, more information, more research that has come about lymphedema. And now we know, especially on the legs, that lymphedema can be painful, not only because there's a lot of tenderness and the skin gets really tight and inflamed, but also because it can affect your joints, right? Having a lower limb or an upper extremity that is heavy, it's going to affect your joints. It's going to start feeling very heavy, and that can actually give you some musculoskeletal pain. Okay, so now I'm going to talk very briefly about lymphedema management interventions. Okay, so the first one that I wanted to show you was what, most people think about surgery, right? So there is a type of surgery that is called debulking liposuction. And I have a picture here of a pre-post, debulking. And then in this particular case, the second one is a lymph node transfer or a transplant. Okay, now these two patients that are here, even with surgery, they would still need to wear compression. They would still need lymphedema management, like with lymphatic drainage, and I'll explain that in a little bit, and also wear garments. So even though it looks like the lymph was, I guess, improved in regards to the swelling and obviously the shape of it, they would still need to do the treatment. I have had patients that ask me about surgery, and I am not a proponent of surgery. And the reason is because it could have so many complications. The lymphatic system, as I mentioned, is the one that helps the body to get rid of inflammation. And after surgery, you're going to have inflammation. And then again, maybe after the weeks of, post-operative weeks after the body starts getting, healing, then the limb might start getting better. But at those first weeks, it's going to be as swollen, possibly more than what it started with. And that could be also very painful. The other thing is, like I said, and it's kind of like, okay, you have surgery, but you still need to do pretty much what my patients have to do to manage it after. Okay. If you see the picture of the vascular lymph node transfer, the picture that is number 2, as you can see, like I mentioned, that redness, the sausage toes, the buffalo hump, and you can see that there is a significant difference in those calf muscles. And the skin actually, as you can see here, is very dry and it gets really scaly. And the reason is because there is no good nutrition to that outer layer of the skin, which is called the epidermis. And the reason is because there's no nutrition from the inside out, right? Okay, so this is what I do. It's called complete decongested therapy. In these pictures, you see this healthcare professional bandaging this leg and also kind of like providing a manual massage on the leg on the right side. As you can see, this patient has swelling in the legs, and complete decongested therapy is the gold standard of lymphedema management. It's completely manual. There's no medication involved. There's no surgery. There is nothing that's going to be invasive. Everything is manual. It's very effective. And like I said, it's the gold standard of treatment. It involves 4 major components. Manual lymphatic drainage, which is this particular type of manual technique, manual massage, that is going to help move all that fluid that, as I mentioned, literally stagnant in between the cells. What we do is we literally get it in the lymphatic collector so it can go back to the circulation and your body gets rid of it through urine, bowel movements, and sweat. It's literally manually draining that fluid and is highly effective. The other thing that we do is compression bandaging, and it's this multi-layer compression bandages that we apply to continue to squeeze the fluid out of those in spaces of the cells, and also to help reshape the leg the way that it should have been had the patient didn't have lymphedema. We would give the patient exercises, very, very simple exercises to facilitate that lymphatic fluid, and also put the patient in a compression garment, because after the decongested phase, the patient needs to continue to manage it. Otherwise, the limb will swell again. And the reason is, as I mentioned, because once those lymphatic collectors are not working, they're not working. What we're doing is literally facilitating that lymphatic drainage manually. And once the lymph is what we call decongested, meaning that it doesn't have that increased fluid in those spaces in between the cells, they can manage it themselves. It's very important that the complete decongested therapy is provided by the certified lymphedema therapist. Even though this treatment looks like it's very straightforward, it's highly specialized. I have patients that come with high blood pressure, and as simple as the lymphatic drainage massage that I provide, I cannot give it, because ultimately the heart is the one that will pump all this fluid out. And then we wait for the blood pressure to, get back to normal levels. Another thing is, you guys were talking about potassium. We have to make sure that the sodium and the potassium are optimal, because the patient can end up with palpitations, with cramping. So that's why this treatment needs to be with somebody that's educated. It's not just a regular therapist that knows how to massage the legs or how to put some bandages. It's actually somebody that is specialized in lymphedema management. A CLT is our credentials, okay? And we provide a lot of patient education. Because first of all, the education will help you advocate for yourself too, especially with those physicians that do not believe that this is actually something that is real. Unless your leg doesn't look like that in the stage 3, they don't think you have lymphedema. And unfortunately, that actually has happened with some of my patients, that going back to the self-advocacy, they just cannot take no for an answer, because their legs are big, they don't feel well, they know there's something wrong with their bodies, and they're not making it up. It's not conversion disorder, because I have heard that, like, the doctor said that I need to see a psychiatrist because it was conversion disorder, because you were just making it up. Like Janine was talking about your particular condition. I don't have that, but I can see, I have experiences with patients saying the same thing, but in this case regarding their lymphedemas. But that was a sign. So anyway, so if we empower the patient with proper education, you guys can advocate for yourself and ask your physician for an order for lymphedema management, and see somebody that will help you with your swelling. Okay, as I mentioned, the components are manual lymphatic drainage, we call it MLD, compression therapy, exercises, and skincare. And skincare, I forgot to mention, as you saw that picture that I show you, because there's no good nutrition from the inside out, moisture, good proteins, because like I said, that is staying stagnant in between the skin cells. We have to make sure that we're nurturing that skin from the outside in, so to speak. And that's why it needs to be washed with like a non-alcohol, that it should be a soap or some body cleanser that doesn't have any alcohol, and also moisturized. And that needs to be done every single day because the skin gets so dry that then it gets itchy and then it can actually get infections, especially when it's very swollen, the pores have expanded, and bacteria that is on our skin, we all have bacteria, obviously we don't see it, can actually penetrate, and then you can have an infection, or the patient can have an infection. The skin infection is called cellulitis, and actually can happen if the patient does not have their lymphedema managed or treated. Okay, so I know I kind of touched it a little bit, but right now I'm going to be a little more thorough about what is the decongested phase versus, or the phase that you go to your therapist, and the phase that you're going to maintain it yourself. So as I mentioned, complete decongested therapy has those 4 major components: MLD, skincare, compression, and exercise. But we do it in two phases or 2 stages. The first one is the decongestive phase. And that is when you actually go to the clinic, in my case, and the patient, I see them 2 times a week. We see them for 1, 2, 3 months, depending on how severe their lymph is congested. And once we get the lymph to a decongestive phase, meaning either normal size, just like the opposite leg, if it's like unilateral or one-sided, if it's two-sided, when the measurements demonstrate that from 1 week to the other is stable, then we put the patient in phase 2, which is the self-maintenance phase, when the patient is managing the lymphedema themselves. And the way that we do that is first fitting the patient with a compression garment, but also with a pneumatic compression pump. And I don't want to get into it too much right now because I don't want to get confused, because I am going to be showing that in some slides to come. Now, it's important to mention that compression garments like a stocking or a sock does not replace lymphedema treatment. So one more time, well-meaning healthcare professionals, because they're not completely educated in lymphedema, then they would say, okay, do you have swelling? Yeah, go ahead and get a compression stocking. And patients go and buy the compression stocking and they cannot put it on because it's so painful. It doesn't fit right. You think you're extra large and you bought an extra large and the stocking doesn't fit. What happens is the stockings or the garments are for maintaining the lymph down as opposed to treat to get the lymph down. The same thing with this pneumatic compression pumps, and I'll explain it once we get to that picture, picture, so that way you know what I'm talking about. These particular machines that facilitate lymphatic fluid, they do not replace the treatment, they're just an added to the treatment for maintenance, okay? Okay, so lymphatic drainage. This particular massage, and we can call it massage because it's a hand technique, is different to a deep tissue massage because it's very superficial, like at the skin level. And the idea is that, and I'm going to say, because obviously I do that, so I'm going to talk in first person. What I do is with my hands, literally open up and clear the lymph nodes that are congested, that are literally, imagine if you had literally this is the better way that I can explain it. There's traffic, and you're in your car and there's so much back of traffic, and you're like, oh man, these cars don't move. And then you get to the point of why there was traffic. There was somebody that got pulled over, or there was an accident, or somebody was super slow. Similarly, in the lymph nodes, if there's an accident, meaning that there's no drainage, there's going to be a backflow of traffic, in this case, the fluid that stays stagnant in the legs or the arms or wherever the lymphedema is, because it could happen in any part of the body. So what I do is opening up, clear the traffic, literally open up those lymphatic nodes, those lymphatic vessels, so the fluid can start draining. I have a joke for my patients that I'm like a plumber of the lymphatic system, right? There's a backflow in your sink, and you see all this water coming. I literally am like the plumber that's going to help drain all that fluid, all that water. And we do that with particular, literally manual techniques that are very, very highly effective. So I have here a little video of the techniques, and I will talk about it as it goes. So this patient has lymphedema. This one is a stage 2 lymphedema. And as you can see, the skin is very dry and it's really hard. That's why you kind of see. As I continue, you're going to notice that the skin is going to start, you see, getting a little softer as I go. And it's because all that fluid is going to be moving. So right now, as you can see, it doesn't look like nothing. And then as I continue to do massage it, the skin starts getting more wrinkly and you can see that there's movement. So there you go. So as you can see, there's some movement there. Different techniques. This one is called pump. And then I don't know if you can see from the picture or from the video, you could not see his shin bone. And now it's being a little more prominent. And it's because all that fluid is being moved up. And we do it up because we're going to go towards the heart, because that's where the circulation is going to go. So that's why you see that the manual technique is up. And I am using different one. This one's called the rotary. And as you can see, the skin continues to get softer and softer, and the limb gets smaller and smaller. Okay. All right. Oops. Okay, compression bandages. So we use what is called short stretch bandages. And what happened with the short stretch bandages in comparison with like an ACE bandage, you probably have seen ACE bandages, there is a main difference. And that's why for lymphedema patients, we do not use ACE bandages because those are what we call long stretch. For lymphedema management, we need them short stretch. And the reason is because what we call pressures. So the lymphatic wrap or the lymphatic bandage or the compression bandage short stretch that we use for lymphedema has what we call a low resting pressure and a high activity pressure. Simple and in layman terms. When you're not doing any type of activity, you're laying down, you're relaxed, that is when you're not going to feel no pressure. It's going to feel very comfortable. It's not going to feel tight. But when you do activities, the bandage is going to provide pressure on the leg in this case, because that's what we see, but it could obviously happen there. And that facilitates more of that lymphatic drainage. That does not happen with an ACE bandage. The ACE bandage are designed, or a long stretch, are designed for stability and in mobility. So if somebody, for instance, sprains an ankle, they're going to, put an ACE bandage because it's going to facilitate no movement, because that's what you want, right? You want to stabilize it. That one feels really tight because that's the idea, to immobilize. But if you start moving, it gives. It doesn't have that good compression when there is movement. So the short stretch, which are the lymphedema bandages, that's what it's providing. That's why it's important that we use those. If you have lymphedema and you go to any therapist that they're just putting ACE bandages because they're cheaper and honestly they are less expensive, that is not. If you were to use those particular other bandages, it can actually harm the patient. They can have skin breakdown, and it's not going to work to facilitate that lymphatic fluid. The other thing is because these bandages are what we call inelastic, and I'm saying inelastic because they do have some elasticity. It's just not like the long stretch. They actually help break down all that tight skin, that fibrosis that I was telling you about. And if you remember the picture of the patient or the lady that has filariasis, that big limb with all those toes that look like wart-like projections, those papillomas, actually with the massage and these compression bandages, we can break that down to get the limb in a more normal, and I know we don't like to use normal, but like a typical limb. And it also provides what we call a gradient of pressure. And this is very simple, meaning that on your foot, there should be more pressure than the ankle, than the calf, than the knee, because since we sit or stand, we have gravity pulling everything down, and we want to make sure that we go against gravity so the fluid can go back up to the circulation. That's the reason why we use what is called short stretch bandages. Here I have pictures of my 3 patients that I have. That as you can see, the first one on the left, there's some toe bandaging, and as you can see, the way it looks like a cast, but it's not. You can actually feel that there's movement. In the second picture, again, this patient also has the toes bandaged because had the sausage toes. And the third one is a completely thigh high. I do have patients that I have to wrap all the way up. They are not the most common. Is when the thigh swelling is very, very significant. Otherwise, with the massage and just the lower leg bandaging, the fluid actually moves. We use different materials in between the bandages to make sure that we are protecting the skin. Because if we were to put these bandages just on the skin, it can actually break it, break it down. The patient can have irritation. And obviously we don't do that. Okay, so after the patient is decongested, we measured for compression garments, and there's different compression garments. They are stockings and there's socks. And here I am showing you 3 different ones with open toe and closed toe. Some patients do not like to have their toes covered. And then there is this type of compression stockings or socks that actually are what we call open toe. And then obviously the regular one that it has the closed toe. Another thing that we have is self-adjusting Velcro wraps for people that cannot put a stocking or they're not very comfortable with them. There is this type of compression garment that it looks like a brace, but it's not. It's stretchy, and then as the garment is strapped, the patient can readjust it throughout the day because it will get loose throughout the day. Here, one of the things that I have patients that tell me all the time that is very hard for them to put compression stockings or socks, and then there is devices that assist. So I have here like a sequence of, we have the donor here, we put the stocking in the donor, and then we literally just put it here on the foot, and then we just continue to push it up, and then that's how the stocking is put with this particular device. And here's the intermittent pneumatic compression pumps. Okay, so in the intermittent pneumatic compression pumps is one of the things that I recommend to every single patient that has lymphedema, regardless if it's primary or secondary. And also, even if it's secondary, no matter the etiology, even if it's cardiac, the patient can use the intermittent pneumatic compression pump. We just have to make sure that we are assessing all the vitals and all the labs and everything, and then prescribing the amount of pressure that is beneficial for the patient without harming or exacerbating any other of their medical conditions. What the intermittent pneumatic compression pump is, it's a sequential pump that is going to inflate from the foot all the way up to the groin and deflate sequentially. And what that is going to do is going to facilitate that pumping mechanism that and I'm doing like this because this is what I do with my hands, as you saw in the video. And it's going to facilitate that movement of the lymphatic fluid from the foot all the way up. This is what I mentioned, that even though this is a highly effective treatment, it doesn't replace the CDT or complete decongestant therapy. The patient needs to go through that whole process so they can really see the progress. I use the pump in the clinic as part of my treatment, and we always order one for home use. So once the patient has the lymph decongested, they can continue managing themselves. All right. As I mentioned, one of the other things we do is skincare, and here you can see how dry the skin is, how flaky. Here, the picture doesn't do justice, but this person has what is called lymphorrhea, which is the leaking, the whipping of the skin. And it's very important because this actually is a huge focus of infection. So I also see patients, obviously, when they have this particular wounds or this particular ulcers or skin breakdown as part of their treatment, because if we were just to bandage without taking care of this skin injury, they can have an infection. And obviously, that's very important to consider. Okay, the exercises. So the exercises for lymphedema, they're actually very simple. They don't even need to be done with weights or anything, because the idea is to keep the lymphatic fluid moving. When I give them an exercise program, the patients, it's literally very simple to move the ankle, pump the ankle, like if you're pressing on the gas pedal, moving your heel up and down, extending and flexing your knee. They can be done standing or sitting. And another thing that I show patients, I should say, is how to massage their lymphatic nodes so they can also facilitate that lymphatic movement. Okay, so I have pictures here of some patients of a pre and post treatment. So we have on our left side this patient that had stage 2 lymphedema. Actually starting stage 3, as you can see, all the skin folds on the foot, all the redness, how dry the skin is, how flaky, all those yellow scabs that you see was actually lymphatic fluid that was dry. This patient has huge problems with mobility. She could not pretty much walk very well. And so when the limb would leak, she could not even, clean it appropriately. And over time it just dried. And that's why you see those kind of scabby lesions that are yellow. We saw this patient and after the 3rd month of treatment, that's the way the legs look like. We were very happy with her progress. She was super happy. She came in a wheelchair and she ended up going with nothing, walking without anything. And that's one of the things that I live for because the legs were so big and swollen. Obviously, that limited her mobility. And then she was able to do everything that she wanted to do, to be with the grandchildren, to go with their daughters, shopping and to restaurants, because now the legs are not heavy and they're not swollen and they're not leaking. And also, as you can see, there's no redness and there's no scabby looking skin, which obviously is also something that in terms of self-esteem and body image will be affected, because unfortunately people will be staring, and that is very, it takes a toll on the emotional state of the patient. And so here's another patient of mine. This lady actually has hemiplegia. She had a stroke that affected her left side. Even though her lymphedema was in both legs, the left side was the more prominent, and the reason was due to that problem with the immobility. If you can see on the left side, there's redness, there's that bigger calf, there's no much of a demarcation of the shin bone and the ankle bones. And then you can see on the right side, we can see a limb that is on the right side, it's pretty much, there's no redness. On the left side is very minimal. There is more of that demarcation of the ankle. As you can see, the knees and the thighs also are not red. This patient, especially because she was wheelchair bound to the hemiplegia, she was red up all the way to the thigh. We did not wrap her thighs because it was not, in her case, it wasn't indicated due to the fact that she was wheelchair bound. But even with being wheelchair bound, she did fantastic, as you can see in this picture. All right, and then here's my other patient. In this particular patient, she actually had wounds, as you can see over here. Her lymphedema was related to arterial and venous insufficiency. As you can see, there's a little bit of a buffalo hump right here. All this skin was all crusty. The shiny skin that you see here, it was literally leaking. And then as we're getting better, the limb gets smaller, but we still have some of those wounds. We still have some of that. And then on that last picture, as you can see, everything is nice and dry. There's no redness. All this is called hemosiderin staining. And it's literally iron that stains the skin because there's no that circulation going back. And the blood, the red blood cells carry the iron, hemoglobin, which carries the iron. And then because that's not returning completely, it starts staining the skin. And so as we do the treatment and the patient gets better, that pigmentation, that discoloration due to the iron actually starts fading too, because we have been able to cleanse that from the spaces in between the cells through the lymphatic movement manually with the compression and the exercises, okay? All right, so now let's talk about other treatments that are part of what I do. Technically, these are not specifically complete decongested therapy, but over the years, I have gotten more education and more certification, and I have learned other techniques that are highly beneficial and also work really well as an adjunctive treatment for complete decongested therapy. So this one is called instrument-assisted soft tissue mobilization. And in this particular case, I'm using a muscle roller, but I use a stone, I use dry brush. There's different materials or tools that I can use. And what we're doing here is I'm breaking down the fibrosis, that tight skin, as I am literally mobilizing the soft tissue. One of the things that happens with patients with lymphedema is that they're also going to have a lot of accumulation of subcutaneous tissue or fat tissue. And when we use the instrument-assisted soft tissue mobilization technique, it actually helps it to break it down as well. Okay. All right, so then is the kinesiotaping. This is a very highly effective technique that I use a lot, and Linda can speak to it. This is literally that athletic tape. If you watch the Olympics, you probably saw a lot of athletes with all these tapes of different colors in their shoulders and their knees. And this kinesiology tape, or athletic tape, as we call it colloquially, it actually helps with different things. Athletes use it for stability, muscle performance, pain management, but for lymphedema, we can use it to decrease the swelling and facilitate that lymphatic fluid movement or lymphatic drainage. And the way that it works is I cut the tape in like little straps, and then I will put them on the skin following the anatomical location of those lymphatic collectors or lymphatic vessels. And then, and you can see in this picture, I don't have an anatomical chart of the lymphatic system here, but literally what I do is I put this tape following those lymphatic pathways for cleansing and draining of that fluid. In this particular case, she had a lot of swelling in the outer part of the knee and here on top of the leg, and then the same thing following that anatomical location of those lymphatic collectors. Okay, so how does it happen, right? That's the question that everybody asks me. So the tape, what it does, it lifts the skin. After I massage it, it lifts the skin, and because it lifts the skin, facilitates that lymphatic flow. Another thing is because as the patient is doing the regular activities, the skin is going to give in with the tape, and that also facilitates the breaking down of the fibrosis or the tight skin. So it's very, very effective treatment. And then there's the low light laser therapy. So low light laser therapy is a type of therapy that's going to use a laser beam, which is going to have a particular purpose on the cell that I'm trying to work on. The way that it works, and I have it here, so it's a little more, it's easier to understand. It's also known as photobiomodulation. So what happens is it's going to trigger a response on the cells due to the release of energy. The ATP is pretty much energy. So depending on the parameters that I put in this laser machine, I can accomplish different things. I can accomplish, pain management or scar healing. But for lymphedema, it works to decrease the swelling and facilitate the circulation back to the heart, decreasing that fluid in the lymph that we're putting this. And again, I am going to try to explain it as simple as I can. So if you go way back to your biology class, we all did take it, right? If you remember photosynthesis, that way that the plant cells produce energy. So they have this particular organs that are called chloroplasts, right? And the chlorophyll, which is the green pigmentation that actually happens in the plants, and that's why we see them green, absorbs the sunlight. And due to the process of photosynthesis, releases energy, and then they have food, right? Very similar in the animal cell, we have this particular organ that is called mitochondria. So what it does is the laser beam actually is being absorbed by that particular organ within the cell, releases energy, and based on the parameters that we use, it's going to have a particular function. In this case, like I said, it would be helpful for edema, swelling, and the circulation and breaking down the fibrosis. It's highly effective, and Linda can speak to it because she has had a lot of those treatments. Okay, so it's important to consider something, and you probably were wondering, and I'm happy to explain it better if anybody has any questions. Most of the time, if not all, when a patient goes to their physician and says that they're swollen, the first thing that the patient is going to receive is diuretics or water pills. So it's important to understand that for straight lymphedema, there is no renal, no kidney problems, no liver problems, no cardiac problems, no lung problems. The patient literally has straight lymphedema. They had cancer, they developed swelling. Diuretics or water pills are completely contraindicated. And the reason is because it's only going to take care of the water and not fluid, which is protein included. So what's going to happen is the lymph is going to get, okay, it was super big and swollen. Now it's smaller, but it's still swollen because it had depleted from water, literally from that particular part of the fluid. And that's why we call lymphatic fluid fluid. We don't call it water because it's just not water. So the diuretic is going to literally just get all that water, but the fluid, the proteins, the white blood cells, the inflammatory factors and all that is going to stay there. So actually the patient can get dehydrated and have kidney injury. So if somebody actually has lymphedema, there's no cardiac problem, no kidney problems, no liver problems, no lung problems, giving them a water pill is actually not indicated. On the contrary, a patient has lymphedema due to cardiac issues, definitely they are prescribed the diuretics. And I always tell the patient, no, you keep taking the diuretic because that's just not only working with your lymphatic, it's actually not working with the lymphedema. It's actually working with decreasing any possibility of having water in your lungs or your heart, or in this case, like I said, the heart failure with the heart, okay? So as I mentioned, the complete decongested therapy has those 4 major components. I have patients that told, that come to me after having failed lymphedema treatments because they go to just receive compression, right? They just bandage my legs. And I have sometimes people calling me, oh, the doctor said that you could come, that I need to come here for you to bandage my legs. So it's really important to understand that just the compression bandages alone is not going to be effective in the treatment and management of lymphedema. It needs to have that lymphatic drainage. It's very, very important because it's like I said, it's like clearing the lymph nodes, opening those vessels so the fluid can move. The compression bandages would work as a girdle in the sense of, imagine you are putting a girdle on the abdomen and you're like nice and, oh, okay, but take the girdle and it's gonna go, right? And the reason is because of that, because the idea with the lymphatic, the compression bandages is like a component that we do after we do the lymphatic drainage massage, which is honestly highly effective and very necessary, okay? And these are references if you are interested. I have my contact information right here. You can email me, you can call the office, or you can check my website. I'm happy to answer now all the questions that you have for me. And thank you so much for listening to my presentation.
Thanks, Dr. Santiago. You use my name a lot of times, and yes, you really were a miracle worker for me. Again, I can't see the questions, Cheryl, if there are any, so you're going to have to read them. Is Cheryl there?
I don't see any questions in there.
Oh, you don't see any questions? Okay. All I can say is that I went through just about all the different methodologies that Dr. Santiago looked at, and I've done it twice because I did really, really well, and then I had an accident and I had to go back and do it again, and we had good luck doing it again, and now I'm just maintaining what she was able to do. So most important for me is that she took away the pain that I thought was periodic paralysis pain, and it wasn't. It was too much lymph in my system. So now I have no pain anymore. And my legs look a whole lot better. They really do. So thank you. Thank you so much. That brings us to the end of our webinar for tonight. And this is being recorded. It will be up on YouTube, and it will be on the Periodic Paralysis International website. You'll be able to get information about Dr. Santiago there if you'd like to ask her questions personally. I think it's been a great time tonight, and I thank you, Janine, too, for sharing your story, because it's always a little bit different, but it's always heart-wrenching to hear what we have to go through. So thank you both very, very much. So if there's nothing else, Cheryl, do you have anything you want to say?
I think it's been very informative. I really appreciate you putting all this together for us, and I got a lot of information.
Okay. Well, good night, everybody, and we hope to be doing this again.
Thank you so much for having me.
We'll find something new. Okay,
Yes.
thank you.
All right, thank you.
Okay, good night.
Good night.
I'm gonna go ahead and stop the recording.